I want to let you know too, I understand that there's really nobody here that has the power to change policy within the VA. But I do want to kind of make a plea for extended treatment within the VA. Right now we're offering through the February 2013 directive mental health and HRT. And it kind of, it's kind of a halfway thing. Having a patient sit in limbo and only on HRT is not good for them. It's not healthy. And there are procedures that are within the skill set of our VA surgeons that can be offered. Orchiectomies, mastectomies. These are things that are done on a regular basis. They're just done for other reasons. And to expect sex reassignment surgery to be offered would be unreasonable. That's a very specialized skill set involved. But orchiectomies and mastectomies are done within the VA often. We can go to the next slide. For many transgender people, one or the other of these procedures would resolve most or all of their type 2 gender dysphoria issues pertaining to surgery. For transgender females, the orchiectomy eliminates the need for spironolactone, a testosterone blocker. It would reduce or eliminate the need for estrogen, both of which would reduce or eliminate certain health risks associated with HRT. And that's my last little thing. Now that was what I said in the teleconference to the VA. But really, we need to be thinking about other treatments as viable options besides SRS throughout our entire insurance system. For me personally, I was born with a extra protein, and that extra protein causes high amounts of both estrogen and testosterone within my body. And I didn't know it until I went in to see an endocrinologist and have blood work done. But my estrogen level was already at a female level. It's just that my testosterone level is high as well. So what that causes is a need for me to take both estrogen and a testosterone blocker. I'm not taking the estrogen because I need estrogen in my system to bring me into a female range. I'm taking estrogen now to try to help suppress the excess testosterone that my body makes. A simple procedure as an orchiectomy would resolve that issue for me. It would remove the testosterone factory, as it were, and I would probably, I would be able to go off all hormones altogether. It's a much less invasive procedure, but yet we, as a society, say, well, you're transgender, so you must have SRS. You must have sex reassignment surgery. And unfortunately, we do this because from a societal point of view, we're trying to make somebody acceptable again. You're not going to be acceptable, this is what we're saying as a society, you're not going to be acceptable to society unless you have SRS. You can either be boy parts or girl parts. And so we're going to stick you on a conveyor belt and, slap on appropriate parts. But even for transgender males, the mastectomy, is not covered either. And so these procedures need to be seen as valid again. I was actually told, I've had this comment made to me several times by medical doctors and so-called psychiatric professionals, that why not just get the SRS? It's covered. Isn't it easier? Really. It's statements like those that tell me what I already know. And that is our medical and psychiatric communities don't really know what it is they're dealing with yet and need much more training. But we as a society have to start looking at a need and see these treatments as an actual need. There's arguments of, it's not a need, it's a choice. But yet Viagra is covered under insurance. Okay. So your erection is not a choice at that point. You need that pill to get that erection, and your erection is now covered under insurance, but it's seen as a need, and I'm not saying it's not. But, a need, I guess, is in the eyes of the beholder, isn't it? We need to start looking at this differently. We need to stop trying to push people into a feeling of either get SRS or shut the hell up. Because there needs to be other viable options. There are other viable paths, and there need to be other viable treatment alternatives. And that's all I have to say on that.